All right. Now, I'm sure most of you have seen this exercise and we have touched on it already in the course, but we have the dreaded open chain knee extensions. So this is one of the most controversial exercises in the context of ACL reconstruction, right? Open kinetic chain quad work. Why? Because it's thought that isolated quad function places an anterior stress on the tibia, especially at terminal ranges, and therefore stresses the ACL graft. So this in part is true, but there's a big misunderstanding here. So let's take a look at this chart here that goes over peak anterior shear forces, or ACL loading, with different types of exercises and different types of movements. So I think that most of us will agree that putting your foot on the ground to some extent with crutches early on is positive for long-term outcomes, right? With the exception of meniscus and cartilage procedures, obviously. But if they had a straight ACL procedure with no other concomitant procedures, we can definitely agree that walking is going to be healthy for restoring muscle function and early healing early on. So not too many people are really arguing that, but many healthcare providers believe that open kinetic chain knee extensions are detrimental to the ACL graft. In fact, many will advocate to never do an open kinetic chain knee extensions after an ACL reconstruction. If we actually look at the data and look at ACL loading, there is more force on the graft with each step than there is doing a 12 rep max open kinetic chain knee extension from 0 to 90 degrees. So it is true that ACL forces increase around the 15 to 30 degree mark in an open kinetic chain knee extension. So you can use your clinical judgment to modify range of motion as appropriate, but I'll touch on this in a bit. But we should not be fearing an open kinetic chain knee extension by placing too much stress on the graft, because with every single step that you're taking with walking, if that patient is putting their foot on the ground, we should not be fearing this exercise. Here are some more evidence-based excerpts here to further justify the use of open kinetic chain knee extensions. So therefore, peak ACL loading during level walking is similar to that measured when performing non-weight bearing, seated isokinetic, and isometric knee extension exercises, and several times greater than the ACL tensile forces reporting with weight-bearing exercises. And with every step, strain on the ACL is 2 to 3 times the strain of open kinetic chain knee extensions, with 30 Newton meters of extension torque at 15 degrees of knee flexion. So strain refers to the length change in the tissue of interest compared to its resting length, right? So that really refers to that stretch, or as we call it, strain here, being placed on the ACL graft.